Are you an occupational therapy practitioner looking for practical strategies to support individuals with functional neurological symptom disorder? If so, you're in the right place. Research shows that FNSD is one of the most common reasons for referral to neurology clinics, accounting for up to 16% of outpatient visits. Despite its prevalence, FNSD is often misunderstood and undertreated, leaving clients stuck in cycles of stigma, disability, and frustration. That's where occupational therapy can make a life-changing difference. Hi there, my name is Habiba and I'm a doctoral occupational therapy student at the University of St. Augustine. My goal for this capstone project is to help other practitioners, specifically occupational therapy practitioners, better understand FNSD, what we can do for our clients, and how to redefine what functional recovery looks like to support meaningful participation and quality of life. The 7-part series was designed to give occupational therapy practitioners the tools and confidence to better serve this population. It draws on current evidence, occupational therapy practice frameworks, and the lived experience of individuals with FNSD to bridge the gap between theory and real-world practice. Welcome to the series. Let's start with what occupational therapy practitioners need to know to better understand, evaluate, and support clients with FNSD. Imagine this: a client suddenly loses the ability to walk, speaks with slurred speech, or experiences uncontrollable tremors. Yet medical tests show nothing structurally wrong with their brain or body. This isn't rare. It's a functional neurological symptom disorder. People with FNSD often report lower quality of life than individuals with many other chronic neurological conditions. They face high rates of unemployment, hospital readmissions, and psychiatric comorbidities such as anxiety and depression. In fact, research suggests that people with FNSD are hospitalized more frequently and for longer durations compared to many other neurological disorders. And here's the key: it's not all in their head. These symptoms are real, disabling, and often misunderstood. That's where occupational therapy comes in. While physicians focus on diagnoses and neurologists manage medical aspects, occupational therapy practitioners are uniquely positioned to address the functional limitations of FNSD. Our role is to help clients rebuild routines, re-engage in occupations, and regain confidence in their daily lives. FNSD is a condition where the brain's normal function is disrupted, like the software glitching while the hardware is intact. Clients experience motor, sensory, or cognitive symptoms that impact their daily occupations. As occupational therapy practitioners, we're uniquely positioned to bridge the gap between medical and functional care. We focus not only on what symptoms look like, but also how they affect someone's ability to live, work, and participate in meaningful activities. Whether it's retraining movement patterns, building strategies for fatigue management, or addressing participation barriers at home and at work, occupational therapy practitioners are critical members of the rehabilitation team. And perhaps most importantly, we bring a lens of validation, recognizing symptoms as real and focusing on empowering the client rather than dismissing their experience. FNSD is more common than most realize. Studies estimate that functional neurological disorders affect anywhere from 50 to 100 people per 100,000 people, making them as common as multiple sclerosis or Parkinson's disease. Clients often spend years bouncing between providers before getting the right diagnosis. That delay can increase disability and distress, making OT's role in functional recovery even more critical. In this series, we'll cover the foundations of FNSD and how it impacts occupational performance, using the model of human occupation to guide evaluation and treatment, practical occupational therapy interventions and strategies you can implement right away, case examples that show real-world application, common challenges and misconceptions, and how to address them, and finally, resources to continue building your knowledge and practice. By the end of this series, you'll feel more prepared to recognize FNSD in your clients, collaborate effectively with interprofessional teams, and provide interventions that promote participation, independence, and quality of life. Thank you for joining this crash course introduction. Next time, we'll dive deeper into a real-life case study and how the model of human occupation helps us understand FNSD. See you there.